secondopinion.org, and this is one of our vignettes on minerals. Specifically, zinc is what we're covering today. The first thing that we go into is the best forms of those elements, so that when you're looking at your bottles, you can evaluate and look at what's best and what quality you're taking in, and then the likelihood that you're getting the right nutrient, the amount in which you need for your best health and your family's best health. The best forms to buy it in is a picolinate or an orotate. But I caution you, picolinate and orotate should not be taken longer than a 3-month period of time, period. Reason why? The good forms of gluconate, citrate, and chelate are ones you can take over a long period of time without any possible problems. There are a few concerned doctors that think that picolinate and orotate possibly could affect your liver over a long period of time. The worst forms, and I do not recommend it, is sulfate. It can be very irritating to the stomach, and I just don't recommend that you have it at all. I've spent most of my time taking people off of zinc sulfate because it's a cheap form, but the problem is it's just tough on your tummy. I would recommend against it whenever possible. Minerals, dirty secrets, I guess everyone has them. Minerals are no different. They didn't even know they had a dirty secret, but it's the manufacturers that are doing them to them. Zinc, when you purchase any mineral such as zinc, you must first find out the total amount of zinc that's actually in the capsule that you're buying. What I mean is, if we buy zinc orotate, okay, and it says 100 milligrams on it, right, the way the law is written right now, they can write zinc orotate's 100 milligrams, but only have 1 milligram of zinc in it, or 5 milligrams of zinc in it. The rest of it's just the orotate. The bottom line is, you're really needing 100 milligrams in each tablet, but you're taking zinc orotate that's only got 5 because it was the least expensive at your local whatever store, okay? The bottom line is, unless it differentiates that zinc level is 100 milligrams and it says it on the bottle, then you possibly and most likely are getting a cheaper form, because zinc is more expensive than orotate. And unfortunately, manufacturers take advantage of that and advantage of you, which is absolutely wrong. At Physicians Premium, when it labels 100 milligrams of anything, it is 100 milligrams of zinc. And the reason that we do it is because your well-being cannot be sacrificed for profitability on manufacturers or companies that cheapen a product that could help you stay well for many years to come. And zinc is one of those key elements. So realize, if you can't differentiate that from what your bottle says, more than likely you have the cheaper form and probably are not getting the dosage that you thought you were. Okay? To be a mineral, it's important to know that it's an organic substance and it's vital for your health and it's vital for your life. Majority of minerals cannot be synthesized by the body, and thus the diet or supplementation must be supplied to be able to get the amount of mineral your body needs and your cells need to function on a daily basis. Synergists are important. I always cover a small section about synergists. I'm labeling them, they're listed right here. Calcium, copper, phosphorus, which there's plenty in your diet. You probably do not ever need to supplement that, and B6. I suggest B6 comes in a form of B complex, not just B6. Should be supplemented with zinc. So if you have a multiple vitamin and you want to take some extra zinc, make sure you take them together so that you get these benefits of these synergists to make sure zinc is absorbed and utilized best in your body. Synergists are very important. A lot of people just take zinc by itself and do not get the great benefit from it that they should, because they don't have the synergist there. Broccoli always pops up on your screen. You probably see it all over the place. If you look at Secrets of Vital Health, you'll see broccoli discussed there too. If you look at the print, look at all this good stuff that's in broccoli. If you're unwilling to eat broccoli or other good foods such as apples, you see the apple, the lady looks pretty happy, she's getting ready to eat the apple. Now look at all these elements that are inside the apple. The apple is made like it is because I can't produce anything close to an apple, because there's so many good elements in it. Raw fruits and vegetables and whole grains and lean meats have elements beyond anything that we as scientists can put in it for your well-being. So the bottom line is, you must eat a good diet at the same time when you supplement, or otherwise you have no chance. Secrets of Vital Health discusses that in detail and gives you the pros and cons of both so you can make good choices for you and your family. And please proceed with that and don't let life get in your way of finding out this information so you make good decisions, okay? Clarifies a lot of things for people. That's the reason why I put it out. Conditions that specifically zinc may help in your body: skin problems, diabetes, acne related to the skin problems, athletic performance can get better, common colds and throat soreness, zinc lozenges help that, Crohn's disease, infertility in males, and there's specific reason for that, macular degeneration, rheumatoid arthritis, decreased sense of smell and taste. There's actually a taste test that tells you if you're zinc deficient, by the way. Immunity problems, wound healing, poor night vision, prostatitis is a big issue, osteoporosis, and peptic ulcers. Okay, those are lots of things if you look at it. Now look at the food sources. Meats, all types, fish, most seafood, liver, eggs, legumes, and whole grains. Risk group, low income pregnant women, and frequently low in United States diets overall. So the bottom line is, most of the time we're deficient. If you got a child that won't eat fruits and vegetables, tell you what, they're probably deficient. More common in alcoholics, elderly, sickle cell anemia, and malabsorption syndromes, as well as chronic kidney problems. Toxicity, it's very rare, but let's say that you did have it. A stomach ache, nausea, mouth irritation, or a bad taste that just doesn't go away. You might be getting excessive zinc somehow. It's very hard to do, but anything's possible. Absorption is blocked by other minerals, taking too many of them, and certain types of medications. And here's the medication list that if you're on these medications might be affecting your zinc levels and affecting your overall well-being. And you saw this big long list of how many things it affects. So it's a pretty important element. Aluminum-based medications, okay, those are many times the things that you take for an upset stomach or things that you take for lowering your acid level in your stomach. Sinus medications, cholesterol-lowering medications, cortisone, antacid medications, we've already mentioned that, antibacterial medications, antifungal medications, anti-inflammatories, aspirin, ibuprofen, naproxen, as well as several others such as Celebrex can affect your zinc levels. Antivirals, HIV antivirals, ones that use for herpes virus, long-term use can affect your zinc levels, which affects your immunity, which is scary. Certain heart medications, hydrocortisone, and prednisone can all affect your zinc levels. Now, if you've not seen Secrets of Vital Health, Secrets of Vital Health are there for a very specific reason, and that is this. It explains in RDA what a recommended daily allowance is, okay? Many times it's too low for your specific needs. However, in men and women, it's 15 milligrams per day. If you've not seen Secrets of Vital Health, please do so you get an understanding that RDA levels are to keep you alive, not to thrive. They don't give you optimal health. Most of the time, they just keep you going. Okay? Dr. Benzinger's advanced information about skin and acne problems. Zinc will help skin repair faster and decreases the amount of scar tissue that might occur. Zinc boosts your immune system, so infections such as those causing acne may improve just by simple supplementation. And zinc, B6, and copper have been shown to be very healthy in general for skin conditions. Our seminar on beauty and skincare might be worthy of your look and review because of what we've just discussed. GI tract or stomach diseases such as Crohn's, these types of conditions frequently will slow or stop the absorption of key elements, zinc is no exception, that help your conditions and help your well-being stay well over a period of time. So zinc is a great help in repairing the damage that occurs from GI duress, and bleeding and Crohn's disease is no exception to that, okay? So just realize zinc is a big deal for that one. Stress of all types, including physical and mental trauma, as well as exercise, just over-exercising. Zinc is one of those elements that appears to become much lower during any event listed above. In other words, any extra stress or trauma that's unhealthy, zinc seems to go down. So supplementing during those acute stress times are probably important. Healing increases and helps to support a lowered immune system that occurs from trauma. If you've not gotten our seminar on stress, it is an absolute. Once you get an idea of what all these stressors actually do to your general body's well-being, it clarifies lots of issues and allows you to heal and understand how to take care of it and prevent it from actually getting you, bottom line. So it's helpful in supporting the adrenal glands and regenerating from injury. Taste and smell. Smokers represent a great group that note a loss of zinc seems to decrease their capacity to taste things. Elderly that eat more and more sweets and more salty things, often it's because they don't have enough zinc. And that is, by the way, really frequent. So zinc is a big issue. Cells that replicate quickly during stress and in your mouth as well as your skin really need zinc. So if you're one that's a sun worshiper and you're breaking down lots of skin cells, zinc is one you're going to need more of, or otherwise you're going to replicate with less quality tissue, less quality skin, less quality look of vibrance and beauty. So zinc is big for skin, okay? And big for taste and even smell, just so you know. Immune system. Changes in the spleen, thymus, lymph nodes have been shown to improve when supplemented with zinc. So your capacity to fight infections get better when zinc is at adequate levels. Zinc also demonstrates protective support in your immune system to protect it from breaking down, and low zinc levels have frequently been shown to exist in cancer patients. Diabetes. Zinc deficiencies have demonstrated reduced capacity for enzymes to work correctly, and one area it shows up is sugar metabolism. So zinc deficiencies are a big issue in diabetes or sugar handling problems. So hypoglycemics, possibly the same issue with chromium, would be a consideration. Insulin resistance is a hallmark of sugarholics, and zinc appears to help clear up this type of insensitivity of insulin and can help diabetes and other conditions. Very important area for men. Infertility in men and zinc do seem to play a direct role with each other. The prostate has one of the highest levels of zinc, and the testicles are right behind it as to storing zinc, so it must be an important element for those areas. Zinc supplementation has been shown to reduce the size of prostate inflammation and enlargement, which as you're getting older is a normal thing to occur, but zinc can help reduce some of that if there's extra inflammation. And zinc supplementation also appears to elevate the activity, strength, and production of sperm cells if the family's having a problem with conceiving and having children. Something to consider. Often is not considered and should be. Dr. Benzinger's possible benefits of zinc. Here's the list again. Acne, skin problems, diabetes, athletic performance, common cold or throat soreness, Crohn's disease, infertility in male, macular degeneration, rheumatoid arthritis, decreased sense of smell and taste. Again, for elderly smokers, those are the two. And many of you might even notice it too. Notice it even more when it's November, December, and you're eating all these sweets. Your taste will get worse. You'll want more and more sweets. Kind of interesting. Immunity, wound healing, poor night vision, prostatitis, osteoporosis, and can even help in certain cases with peptic ulcers. Okay? Zinc, important element, an unbelievably important element, something I highly recommend that you look at very closely because it's safe and helpful for the body. This is Dr. Benzinger on Health. We hope you've enjoyed today. We'll look for you next time, and may God bless you.